Good afternoon, Mr. Chairman and Committee. My name is Dr. James D'Agostino, Doctor of Physical Therapy, representing the private practice section of the American Physical Therapy Association and PTPN, Physical Therapy Provider Network, the largest independent provider of physical therapists. And we are opposed to this bill because of the physician ownership concept of it, the ability for medical corporations to own physical therapy. Physician-owned clinics, POPs, have been proven to be one of the biggest healthcare scams of our times. We know through private, public, and medical research that every time a physician owns a clinic, they order 2.5 times more care, they charge more, and 9 out of 10 times the care falls below professional standards. And we believe the state of California is going to share in some of this abuse. That book you've just been given demonstrates some of what CalPERS might be responsible for. And as a result of this abusive system, President Obama in his budget recommended banning federal payments for physician-owned physical therapy. And October 1st, my friend, Congresswoman Jackie Spears, author of the PORA legislation in California, introduced H.R. 2914, which would ban payment from Medicare for MD-owned PT, imaging, laboratory, and radiology oncology services. The physicians who supported Ms. Spears in this bill said that the physician behavior in these business arrangements is shameful. And I'd like to say here we are today talking about passing this shameful arrangement. I would also like to remind you that with the new workers' comp fee schedule that's coming up to be implemented in January, physical therapy fees will increase significantly. AB 1000 will provide the legal cover for medical mischief in the workers' compensation system, as this new fee schedule will probably encourage workers' compensation mills. So, I would like to encourage you to consider the total physical aspects of this bill and vote no on this legislation. Thank you.
Thank you. Next witnesses in opposition. I know that you've been very, very, very patient waiting for this bill to come up. I'd ask you to be as succinct as possible. I am cognizant you've been here for a long time, so please proceed.
Thank you. Good evening, ladies and gentlemen of the California Senate. Before I begin, I would like to say that as a grandson of Sicilian immigrants, it's both an honor and privilege to be here today. Now then, my name is Dr. Frank Verdoliva. I'm a doctor of chiropractic. I'm also a doctor of jurisprudence. I'm also on the board of directors for the International Chiropractic Association of California. We oppose AB 1000 and foresee the strong possibility of abuse through misappropriation of doctors' hiring for self-referral and financial gain. I would like to briefly reference a study published in the Journal of the American Medical Association, October 21st, 1996, which evidences that where there was doctor ownership of physical therapy services, visits per patient were 39 to 45% higher, and additionally, both the gross and net revenue per patient were 30 to 40% higher. I want to thank you for your consideration.
Thank you. Thank you very much, Doctor. Next witness in opposition.
Hi, Dr. Paul Gaspar, physical therapist and director of the Physical Therapy Business Alliance. I'll be brief. This bill, AB 1000, is probably one of the most expensive bills heard today. We obviously oppose it also because of the physician self-referral for profit aspect. And what will the citizen get for that money? They will get largely abusive health care in physician self-referral physical therapy settings. They'll get $10 million in CalPERS wasted spending, millions in California workers' compensation wasteful spending, and California's share of $2 billion in Medicare overpayments, according to a GAO study coming out next month. The massive unnecessary health care tab could not possibly be the result of just a few bad physician actors, but instead a very human behavior to place profits above patients. So it's understandable that there really isn't anybody here today to support the bill. AB 1000 redistributes unearned health care dollars to wealthy physician specialists and will cause part of SB 863 work comp reform to backfire. Respectfully, the only three good choices regarding this bill are to vote no, to hold off and make it a 2-year bill to get more information from the California Workers' Compensation Institute and the GAO, or number 3, amend the bill as suggested by all healthcare policy experts to allow physician self-referral profits only in accountable care organizations or Knox-Keene organizations where physicians have no incentive to self-refer for profit. Finally, I would like to apologize on behalf of all practicing physical therapists for the California Physical Therapy Association agreeing to bill language that would put patients and taxpayers in harm's way. Thank you.
Thank you very much, Doctor. Next, opposition.
Hello, my name is Dr. Jeff Fairley. I'm a physical therapist and public policy director for the Independent Physical Therapists of California. Very briefly, this is a compromise bill. It's a compromise bill between the California Medical Association, the California Orthopedic Association, the Podiatry Association, and the California Physical Therapy Association. So one must ask, what are people getting in return? The California Physical Therapy Association is going to get some form of direct access without the ability to perform diagnosis. It's doubtful that we will be able to get paid. What is California Medical Association and the California Orthopedic Association getting in exchange? They're getting the ability to have the legal cover to own physician-owned practices. And their very own primer, which is in this book, they believe that they can earn $100,000 per year with physical therapists in their clinic. That's what this trade is about. The people who pay are the citizens of California and the state of California, as our basic calculations on the cost to CalPERS shows that it could be up to a $10 million cost to CalPERS.
Thank you.
Thank you.
I'm going to ask the remaining witnesses in opposition if they could state their name and presumably...
I understand.
Yes.
I'm from Inland Empire as well. Yeah.
Okay.
How can I treat your patients today? I'm Teresa Rogers. I'm a doctor of physical therapy. Have a small practice in Southern California in Redlands, and I strongly oppose this bill due to the 5 to 6 patients an hour that physician-owned practices see compared to mine, 1 or 2. Quality care, first do no harm.
Thank you. Thank you so much. I think by the time we're done soon, the members, as well as staff members who've sat there, will need some physical therapy as well, too. Yeah. Yeah. Yeah.
My name is Tammy Ordis. I'm a doctor of physical therapy in private practice for over 10 years, and I'm very strongly opposed to this.
Thank you. What is your name again, Dr.
Tammy Ordis.
Ordis? Okay, thank you. Yes.
Hi, I'm Simon Gibson, Montclair Physical Therapy in Oakland, California. We already have physicians in our marketplace who employ low-cost employees to deliver physical therapy. I believe that will become rampant if AB 1000 passes. Please vote no on AB 1000.
Thank you very much, Doctor. Any other remaining witnesses in opposition to the measure? Seeing that, Finance, do you have a file?
Mr. Chair, Finance is neutral on the bill, but notes a concern. We note the concern that is unclear if the bill requires workers' compensations to pay for direct access to physical therapy, which could result in increased statewide workers' compensation costs.
Okay. With that and without objection, we will move this measure to the suspense file.